Welcome back to my channel. And if you are visiting this space for the first time, you are also highly welcome. This is quiz time, and in this section, we'll be looking at questions that are related to the innervations of the lower limb. And by the end, we would be going through the answer section where we'll be evaluating our thoughts. If you are able to scale through these, it sure means that you are ready to tackle any questions related to the innervations of the lower limb in any examination. So ride on with me as we go through this. So the first question reads that the muscles in the anterior and the lateral compartment of the leg are innervated by which nerve? Is it the common fibular nerve? Is it the tibial nerve? Is it the sural nerve? Or is it none of the above? The second question reads that the sural nerve is it a motor nerve? Is the sural nerve a direct emergence from the sciatic nerve? Is the sural nerve a sensory nerve? Is the sural nerve a direct branch of the sacral plexus? And the third question reads that the sensory innervation of the medial anterior two-thirds of the sole of the foot is provided by, is it provided by the lateral plantar nerve? Is it provided by the sural nerve? Is it provided by the medial plantar nerve? Or is it provided by the deep peroneal nerve? So which of these nerves is responsible for providing sensory innervation for the medial anterior two-thirds of the sole of the foot? The fourth question reads that tibialis anterior muscle is innervated by, is it innervated by the tibial nerve, innervated by the sural nerve? Is it innervated by the medial plantar nerve? Or is the tibialis anterior muscle innervated by the common peroneal nerve? The fifth question reads that the tarsal tunnel syndrome is caused by compression of, is it caused by compression of the femoral nerve? Is it caused by compression of the saphenous nerve? Is the tarsal tunnel syndrome caused by the compression of the common fibular nerve? Is the syndrome caused by the compression of the posterior tibial nerve? So which of these nerves is compressed in the tarsal tunnel syndrome? The fifth question reads that the following are branches from the femoral nerve, except, is it except the nerve to the sartorius muscle? Is it except to the medial femoral cutaneous nerve? Is it except to the saphenous nerve? Or is it except to the lateral femoral cutaneous nerve? So which of these nerves is not a branch of the femoral nerve? This is what this question means. The seventh question reads that the muscles in the posterior compartment of the leg are innervated by. Are they innervated by the tibial nerve? Are the muscles in the posterior compartment of the leg innervated by the femoral nerve? The muscles in the posterior compartment of the leg, are they innervated by the saphenous nerve? Or is it none of the above? So the eighth question reads that the short head of the biceps femoris is innervated by. Is the short head of the biceps femoris innervated by the femoral nerve? Is it innervated by the common fibular nerve? Is the short head of the biceps femoris innervated by the tibial nerve? Or is it none of the above? The ninth question reads that the sciatic nerve is a branch from the lumbar plexus. Is the sciatic nerve seen to run through the lesser sciatic foramen for it to exit the pelvis? Or is it seen to run through the greater sciatic foramen for it to exit the pelvis? Or is the sciatic nerve a pure sensory nerve? So which of these options is correct as it relates to the sciatic nerve? So the 10th question reads that the saphenous nerve is a branch from the sacral plexus. Is the saphenous nerve a motor nerve? Is the saphenous nerve a branch from the femoral nerve? Is the saphenous nerve a direct emergence from the lumbar plexus? So which of these statements is correct about the saphenous nerve? And the 11th question reads that the sensory innervation of the dorsum of the foot is provided by, is it provided by the tibial nerve? Is the sensory innervation of the dorsum of the foot provided by the common fibular nerve? Is it by the sural nerve, or is the sensory innervation of the dorsum of the foot provided by the saphenous nerve? The 12th question reads that the following general statements concerning the innervations of the lower limb are correct, except that the lower limb is innervated by branches from both the lumbar and the sacral plexuses? Or is it that the sural nerve is formed from branches from both the tibia and the common fibular nerve? Or is it that the sciatic nerve originates from L4 spinal nerve through the S3 spinal nerve? Or is it that the femoral nerve is a pure sensory nerve? This is answer section, and this is where we'll be evaluating our thoughts. For the first question, the muscles in the anterior and the lateral compartment of the leg are innervated by the common fibular nerve. It is the common fibular nerve that provides innervation for the muscles in the anterior and the lateral compartment of the leg, while the posterior compartment of the leg is innervated by the tibial nerve. The second question, the sural nerve is a pure sensory nerve. It is a pure sensory nerve that provides sensory innervation for the posterior lateral region of the leg and also the lateral edge of the foot. We've tried to highlight this in our lecture on both the tibia and also the common fibular nerve. You can go and check that lecture up to keep yourself updated. For the third question, the sensory innervation of the medial anterior two-thirds of the sole of the foot is innervated by the medial plantar nerve. It is the medial plantar nerve that provides sensory innervation for the medial anterior two-thirds of the sole of the foot, while the lateral anterior one-third of the sole of the foot is innervated by branches from the lateral plantar nerve. The third question, the tibialis anterior muscle is innervated by the common peroneal nerve or the common fibular nerve. This is what provides innervation for the tibialis anterior muscle. The fifth question, the tarsal tunnel syndrome is caused by compression of the posterior tibial nerve. The posterior tibial nerve is a terminal region or section of the tibial nerve. And when this region is compressed, it will lead to the tarsal tunnel syndrome. The fifth question, the following are branches from the femoral nerve except the lateral femoral cutaneous nerve. This nerve is a direct emergence from the lumbar plexus, while the other branches, which include the nerve to the sartorius muscle, the medial femoral cutaneous nerve, and also the saphenous nerve, these three nerves are emergence from the femoral nerve. The lateral femoral cutaneous nerve is not a direct emergence from the femoral nerve, but it is an emergence from the lumbar plexus. The seventh question, the muscles in the posterior compartment of the leg are innervated by the tibial nerve. We've tried to highlight this in our previous slide when we tried to describe the innervations of both the anterior and the lateral compartment of the leg, which of course is provided by the common fibular nerve, while the posterior compartment of the leg, innervations of this region is provided by the tibial nerve. The eighth question, the short head of the biceps femoris is innervated by the common fibular nerve. This is what provides innervation for the short head of the biceps femoris. We know that the biceps femoris is part of the component of the hamstring muscles. These hamstring muscles are innervated by the tibial nerve, except the short head of the biceps femoris. It is this exception that is then innervated by the common fibular nerve. We also try to highlight this in our lecture on the common fibular nerve. You can go and check that lecture up to keep yourself updated. The ninth question, the sciatic nerve. The sciatic nerve runs through the greater sciatic foramen for it to exit the pelvic cavity. And it is through this course that is able to exit the pelvic cavity to enter into the posterior region of the lower limb. So this is how it exits the pelvic cavity after its emergence from the sacral plexus. The 10th question, the saphenous nerve is the branch from the femoral nerve. The saphenous nerve is a sensory nerve that emerges from the femoral nerve. The 11th question, the sensory innervation of the dorsum of the foot is provided by the common fibular nerve. It is the common fibular nerve that provides sensory innervation to the dorsum of the foot, while the sole of the foot is innervated by branches from the tibial nerve, which include the medial and the lateral plantar nerve. The 12th question, the following general statements concerning the innervations of the lower limb are correct, except that the femoral nerve is a pure sensory nerve. The femoral nerve is not a pure sensory nerve. It exhibits both sensory and motor innervations. So this is the option that is incorrect. So I hope you did well. So let's know your grades in the comment section, and thanks for watching.